So, Dr. Sara, let's discuss are there any side effects of those injections?
Diabetes, pre-diabetes, hyperlipidemia, sleep apnea, fatty liver.
All that we knew earlier was this were originally meant for diabetes control. These medicines were originally meant for diabetes control. So, how did they? We will be discussing about GLP-1 agonist or weight loss injection. So does that mean that not just diabetic, it can also be used for non-diabetic people, or should it be used only in diabetic people who are obese or who have?
And GLP-1 medications can be powerful tools if used in a right way, along with adjunct of diet, exercise, and proper support.
Who will be the ideal candidate? Who should you be advising for such weight loss injections? Who is the ideal candidate for this treatment?
Constant feeling, maybe bloating or that benching. Some people who have pain abdomen, they are often.
So what are the common side effects which we have been seeing with this weight loss injection, especially over a period of say 6 months or 1 year?
Can experience inflammation.
Namaste everyone. Welcome to yet another episode of a medical podcast. I am Dr. Amitabh Kulkarni. Today we are going to discuss one very interesting and commonly discussed topic, GLP-1 agonist, or in common man's language it's called as weight loss injection. Whether it is celebrity or social media influencer, it is being discussed a lot. I am very happy I am joined by Dr. Sara, who is an experienced endocrinologist dealing with treatment of such cases. We will be discussing about GLP-1 agonist or weight loss injection. How does it work? Are there any side effects of those injections? Who should be using it? Who should not be using it? So I'm very happy to be joined by Dr. Sara. Dr. Sara, welcome to the podcast and thank you for accepting the invitation. Dr. Sara, can you tell us something about your background?
Hello, I am Dr. Sara Alam. First of all, thank you, Dr. Kulkarni, for inviting me here. It's my absolute pleasure to speak on this often discussed topic. I have done my MBBS, then MD in internal medicine. Then I did DM in endocrinology from AIMS, New Delhi, India. And I have been practicing in UAE for more than 3 years now.
Thank you, Dr. Sara, for your introduction. So, Dr. Sara, let's discuss what is GLP-1 agonist? How does it work?
Okay, so GLP-1 agonist is a technical term basically. GLP-1 is a natural hormone inside our body. When we use these medications, these are basically injections, stimulate this GLP-1 in the body, and they help control hunger and improve the satiety level. To summarize that, it makes you feel full faster.
Okay.
You don't have that craving to eat more.
Okay.
And produce an energy deficit and help you lose weight.
That's how the weight is lost. Yeah.
People who have been struggling with weight loss for years on, they find it now easier to lose weight. Obesity, now our understanding, is changing. Previously, very oversimplification that just eat less and move more. It's like saying to a person who is depressed, like cheer up.
Right.
It's an oversimplification. It's a complex disease, and more research on its biology is coming up. So we are now understanding that it's actually not okay to just tell someone you eat less and move more. It's we need to understand what are the complex pathophysiologic mechanisms involved in a particular case, and hence deal with that accordingly. This GLP-1 agonists, they sort of produce some slight nausea. That's a side effect also and a manifestation of its effect, because that's how they work. I will tell you a very interesting thing. I remember still very vividly when I was in MBBS and it was second year pharmacology lecture. And my professor, we were discussing, they were just new drugs which came up and very initial phase of development. So our professor, he told me, there are some new drugs coming up and they cause excessive nausea. And because of this nausea, no one is ever gonna use them. And see, here we are.
Yeah.
We are discussing about it. Everyone is talking about these medication from Hollywood celebrities to Bollywood. I mean,
It's a blessing in disguise when everyone thought it may not be useful.
exactly.
It is
So
being
it's
used
science.
widely.
Science evolves and it changes very fast.
Now, all that we knew earlier was this were originally meant for diabetes control. These medicines were originally meant for diabetes control. So, how did they got routed to weight loss injections?
So that's also interesting. So I'll tell you first because for our viewers that what are these medications. So they are a lot of medications of GLP-1. So
Right.
it's a class of medications.
Right.
So initially when they came, they were mostly used as daily injection. Many of the people may be knowing by their common name. The daily is liraglutide, which is Victoza and Saxenda. But now most common use, which is weekly injection, semaglutide, which is Ozempic and Wegovy, and now the latest one is tirzepatide, which is Mounjaro. So when the trials were going on, basically for diabetes, it was noticed that people were losing weight and a lot of weight. Actually, I still remember there was some trial while I was in residency going on in our institute also, and some of the participants were losing around 50 kgs of weight. That was like immense. And then later on, there is a way for FDA approved medication for obesity therapy. So for granting any medication to be FDA approved for obesity, there are certain criteria to be met. Then later on, these GLP-1 weight loss injections, which were initially launched for diabetes, they got approval for obesity as well, but there is some criteria. It's not like anyone
You cannot use it for every person.
Exactly. So there are certain criteria. If that criteria are met, then they are eligible to use these medications.
Now, coming to the indications, now we have seen that this was used initially as an anti-diabetic. Additionally, it is being used as a weight loss injection also. So, does that mean that not just diabetic, it can also be used for non-diabetic people, or should it be used only in diabetic people who are obese or who needs weight loss?
Actually, it can be used for both. It depends upon what are the indications. So for diabetes, of course, they can be used. But people with BMI more than 30 kg per meter square or BMI more than 27 with any associated weight-related condition, they can use it. But of course, have to evaluate first. Basic laboratory investigations also have to be done. What is the cause of obesity? Is there any associated risk factors? And any contraindication as well has to be checked. It's not like now there is also, I want to highlight that many online pharmacies or online prescriptions people are getting even without any consultation.
Okay.
So that is actually quite dangerous.
I agree. So then, viewers, please understand that this can be used for weight loss, not just for diabetes. Yes, additionally, it will help in control of sugar if you have diabetes. But it can also be used for non-diabetic. But don't use it without physician's consultation. Don't just use it because some online pharmacy is selling it at whatever rate. So please be careful before taking this injection.
I want to add here that we often get that, okay, my friend is using, I want to use it.
Exactly.
Or like I have a friend's marriage coming up and I just want to lose this 5 kilo.
Yeah.
So it's not short term, like quick magic pill. It's powerful medication, but it should be used under supervision and if indicated.
Yeah, exactly. So, as Dr. Sarah correctly said, just because your friend is using or you have some target weight loss coming up for a marriage or a function, it should not be used. So, that brings us to the next question then. Who will be the ideal candidate? Who should you be advising for such weight loss injections? Who is the ideal candidate for this treatment?
See, every medication has its risk versus benefit.
Right.
If there is associated any weight-related condition, diabetes, pre-diabetes, hyperlipidemia, sleep apnea, fatty liver disease, such people they benefit the most with the weight loss. Will have severe osteoarthritis of knee, they're not able to
Do exercise.
Yeah, exactly. Depends upon what are the indications and the criteria and. As per that, so it's not like a one size fits all.
Correct,
It has
correct.
to be personalized, and depending on that, we have to prescribe. Also, the dosage, the guidance, how to increase the dose, and what to do if facing side effects. Because we see many people who are using it for diabetes, like they quit midway because some people have started with straight away with high dose. Even many doctors like they prescribe them with the higher doses and then they face lot of side effects. So go slow. First of all, not to have side effect before having any effect, so that you are able to tolerate it well. As I told you, when initially start, there is nausea, and then it becomes okay after using it for a while. So. Yeah. It has to be supervised and managed and monitored in a proper way.
So there are various reasons apart from diabetes in which we or endocrinologists do use this injection. But that reason, patient, please don't decide yourself. You should consult the authorized doctor or physician, and then only you decide whether we should be going ahead with those injections. Now. Once someone starts on this injection, realistically, how much weight loss they should expect and what duration they should expect the weight loss?
Okay, so one very important concept which is coming up in the field of obesity is that obesity is a chronic disease. So whatever the factors, they sort of come back. So if somebody just comes with this goal, okay, I'll use it for 1 month or 2 months and then stop it, lose 10 kilo and then go back.
Not like a crash course of weight loss or anything
yes,
like that.
It's not like that. It's the weight you lose, it will most often come back. One.
Correct.
Secondly, in the clinical trials, 5 to 15% of weight loss is seen, but many people do lose much more, and some people are slow responders. So I have seen people lose, as I told you, 50 kilo also. It took around 1 year, and you won't believe, people, it's something which we never witnessed before. It's like people coming with HbA1c initially very high, and they were on insulin, multiple anti-diabetic medication, antihypertensive medication, and many of them managed to be off those medications actually. So it's actually very powerful to witness something like that, but it's not happening with everyone. So we have seen people also sometimes getting frustrated that okay, my friend lost that much weight, I'm not losing, what's wrong? And also one interesting thing I would like to tell you, I have had people call me third day, doctor, I didn't lose weight. I said, you just took it.
You have to be patient.
3 days back. Have to be patient. It takes time, and but most people do lose weight. The amount may vary, but it's a long-term process. It's not like a 1 month or 2 month process.
Correct. Viewers, please understand, it's not a magic injection which is going to change everything overnight. So even if you start injection now, it's not that next day you are going to see some magical transformation. So you have to be patient, and especially in medicine, if you want a sustained effect of any medicine, you have to wait patiently for some time. So now another question which probably you must be encountering, that someone who is already taking GLP-1 agonist or weight loss injection and he's losing weight, does that mean that he need not follow a strict diet or he need not do exercise or he can stop exercising after taking this injection?
I think this should be reinforced again and again that exercise is super important. It's because when you lose weight, there's also some amount of muscle loss. So to preserve muscles, you have to exercise. It's for preserving the muscle mass of the body. Exercise is very important. Secondly, people need to do diet and exercise, a healthy diet and exercise, so that they don't have deficiencies. So what happens overall? Your appetite reduces. So even if you eat brownie or a small slice of pizza, you may still lose weight because overall you are just eating that.
Correct.
But
Correct.
you will end up feeling weak, feeling low, and will encounter a lot of nutritional deficiencies. And also, people may require some supplements while on these medications. Especially now, people are using it. They who have undergone bariatric surgery before, so they also need to be on as per the guidelines who have undergone bariatric surgery. Depending upon your case, what kind of profile, what are your lab results. So, diet, following a very balanced, nutritious diet is very important, and doing regular exercise. And exercise, whenever I think we can have another whole podcast on that strength training. It's
Correct.
really important,
Correct.
and especially for women who are doing strength training for preserving bone health and preserving muscle mass. That cannot be stated enough. I mean, to say the benefits of exercise, especially in people who are taking GLP-1. So you will lose weight even if you are not doing any diet and exercise, but that's not good for you.
So friends, please understand, diet and exercise are very important. Their benefit is not just for weight loss, it is beyond that, not just for sugar control, it is beyond that. So a balanced diet and exercise, regular exercise is cornerstone of any treatment. But just because you are taking GLP-1 injections and you are losing weight, you are benefited, that does not mean that you should stop exercising or you can be a bit relaxed with the diet. You still have to be very particular with the diet and exercise for this. So now one common question a patient usually asks now, we are seeing benefits of weight loss and all, but no medicine probably is without any side effect. So what are the common side effects which we have been seeing with this weight loss injection, especially over a period of say 6 months or 1 year?
So I think that is the most commonly asked question. First question, what are the side effects? So every medicine does have side effects. There is whenever there is an effect, there is a side effect. As I discussed before as well, the most common are the gastric side effects. So
Right.
there is this nausea, vomiting, not that common, but nausea is that constant feeling of maybe bloating or that belching. Some people do.
So what are the common side effects which we have been seeing with this weight loss injection, especially over a period of say 6 months or 1 year?
Do rarely can experience inflammation of pancreas, which is called pancreatitis, or gastroparesis, where the food movement is slowed.
Yeah.
These are sort of extension of an effect because it slows down the movement of food in the stomach. So that can happen, but these are rare side effects. Then animal studies, it was shown that it may affect thyroid cell growth. Mostly data from the animal studies.
Right.
So anyone who have a history of a rare kind of thyroid tumors in the family, which is called medullary thyroid cancer, they should not be taking these medications.
Okay.
Then when suddenly the blood glucose levels, especially in people with diabetes, actually this can happen with any medication which controls
Sugar.
very, there's a sudden drop, so there may be eye changes also. So these are the most commonly encountered side effects, but there are a lot of benefits also. So overall, most people what experience there are minor side effects. However, some people can have rare side effects as well. So it should be well investigated whom we are giving the medications. Then, of course, there's a lot of talk about this muscle loss.
Right.
But muscle loss will happen with any kind of weight loss. That's why we have to focus on diet, strength training. Then there is this talk about, maybe you have heard, Ozempic face.
Correct.
That also, suddenly losing a lot of weight, not having enough proper protein in the diet, all of these things. So that's not something specifically related to GLP-1, but to any kind of sudden weight loss. Can cause these, the skin becomes loose. So have to sort of reinforce that people need to exercise and take a proper diet to not have these side effects.
So this was very informative, Dr. Sara. Please understand, no medicine is without side effects. So don't take any of these injection unsupervised just because they are available online. So you have to monitor them for, like, say, pancreas infection or any other side effects regularly.
It's not a recommendation to check like mayonnaise lipase regularly unless somebody is experiencing any particular symptoms like pain, abdomen. Then we do check it.
Yeah, so that brings us to the next question. How long one person can take it then? In that case, suppose if someone is benefited with this injection, can he take it for lifelong, for years? What's
So that's a very important question, and it's often asked. Actually, it can be taken for, it's a chronic medication. It's approved for chronic use.
Correct.
And now the studies are showing that obesity is a chronic condition, and people do tend to gain back the weight. Not all, but some of it does come back. That also depends. Many of my patients have been off the medications and are able to maintain the weight as well. So that depends. So if you're taking it for diabetes, it's actually continued as a chronic maintenance medication.
Okay.
For weight loss, possible to stop it as well. Depends upon you, like what are the factors which you were, like, suppose as because of the initial weight people were not able to do exercise, and once they lose the weight they feel that they are able to maintain the weight in a better way. So that depends. With this, I'll tell you something. So it often happens that, like, my patients, they were initially, suppose one patient came with the high HbA1c of 15, and when he started on GLP-1, he lost a lot of weight and his blood glucose improved a lot, and his HbA1c became 5.7. And then the insurance, they refused that now your HbA1c is normal. But come on, it's normal because of the medications. It's like a maintenance. And he was having type 2 diabetes to begin with. He was taking it for type 2 diabetes, and he needs, so it's like hard time explaining to them and writing long reports, because they see that number, but that number is reached because of the medication and the treatment, and he had type 2 diabetes, the patient. So these things need to be understood, that once stopped, the blood glucose may increase, and the weight gain may also be there.
So that was going to be my next question, in fact. Like, since these medicines are like weight loss covered in most of the insurances, or how does this work, especially in, like, say, UAE, where most of the treatment is driven by insurance? So is it very difficult to get it covered in the insurance, or most of the insurances cover these injections?
It also depends upon the insurance policy, but they are covered for type 2 diabetes only, not for weight management, unfortunately. Although maybe with so much research coming up that obesity is also a chronic disease, and people who need these medications, maybe the coverage will in near future it may get covered, and they are costly, expensive medications actually.
So they may or may not be covered in insurance. It depends on your policy. Now we can see there are so many GLP-1 agonist injection, whether it is semaglutide, liraglutide, ozempicide, or many more are there. You know better. So Mounjaro, Ozempic, and Wegovy, and all. So all these are same, different, or what exactly is there difference between these injections?
So they are not the same. Ozempic or Wegovy is semaglutide, which is once weekly injection. Then there is a oral formulation also, which is Rybelsus. Then we have this oral semaglutide is not approved for as a weight loss. It's approved only for patients with type 2 diabetes. Then we have Mounjaro, tirzepatide. It's a dual mechanism. So tirzepatide has dual mechanism, hence making it more effective than GLP-1.
Yeah.
So they are different and needs to be seen which. Also, we have approval for pediatric cases in which we don't have approval for tirzepatide yet, although trials are going on. Okay. In those cases,
you mean to say type 1 diabetes?
No, I'm talking about pediatric obesity.
Pediatric obesity.
So in pediatric obesity, we don't have approval for tirzepatide yet. We have approval for semaglutide, Wegovy for weight loss, and also for liraglutide approved for that. Coming to type 1 also, now many trials are going on and showing good results. So maybe in near future we may get approval. Right now it's not approved for patients with use in type 1 diabetes.
This is very, very important. All of you should know that it is mainly for type 2 diabetes mellitus with specific indication, not for type 1 at all as of now. Maybe in future, we don't know, so many trials are happening, and it may be a good news for type 1 diabetes also. So we do see a lot of social media discussion, celebrity discussion about weight loss injections. So is it actually a reality, or is it just a hype? What do you want to say about this?
See, I would say that some of the hype is justified to some extent because, as I told you, we never encountered such kind of results before in patients. You won't believe, I had a patient whose HbA1c is a number. It's like a 3 months average of blood glucose, and higher the number, it means higher your sugar is. So I got a patient, his HbA1c was 17%, which is like a number which is so high which makes you jump from the chair. You get a panic calls from the lab, doctor, the HbA1c is 17. And after 3 months, patient's blood glucose improved so much, it reached 7%. Or he was of course given other medications other than GLP-1 as well, but we never saw such results. So of course, but it's associated with side effects as well in patients. So it's like anything which has good effects may have side effects, but so the hype works both ways. So when we see the hype, we also see that any rare side effect also gets the headline that which is like a rare. Then some of my patients, they stopped using these injections. Like they were getting approval from insurance, they were improving, then said, no doctor, we don't want to use it anymore because I read it in the news that it's causing this stomach paralysis or any such side effects. But people who are tolerating it well, who are not facing any side effects because of the social media buzz, they may hesitate for that. Also, I want to point out that there's also a lot of stigma. See, you are taking the easy way. It's not like that.
It's not a shortcut, yeah.
So the patients, they are also shamed for using the GLP-1. A lot of things with the social media. The more people talk, the more judgment is there. So a lot of things are there.
So friends, please understand the treatment is always individualized. Someone who is having certain side effects because of that particular injection, you may not get it. So it is always better to discuss with your physician, endocrinologist, diabetologist. Before drawing any conclusion, don't just go by the social media discussion. Social media discussion, it's a double-edged weapon. Sometimes it is good, but sometimes it is harmful also. So we always tell that although we are discussing these podcasts for common people's interest, we always suggest that you should always discuss with your physician before drawing any conclusion after this particular talk, or before, if you want to discuss about your health. Dr. Sarah, coming back to our questions now. A person is obese and he want to lose the weight. He reads about this on social media, through YouTube channels, and then he just walks into your clinic. I want to lose weight. Can you give me that injection? So, is it possible that anyone can walk into your clinic and take the injection and the things are done? Yeah.
If he is walking into my clinic, then he's coming to the right place. But people are going to the pharmacy and buying it, and there are many countries they are selling generics of that. Compounded pharmacies are selling them. So the thing is that unregulated use without any lab investigations, without any physical examination, without any history is very dangerous. But it's available over the counter. It's not a control or a prescription only medication, although should be, but people are getting it somehow.
Yeah. So if you really are worried with your weight, you want to lose your weight, consult an endocrinologist or obesity specialist before taking this injection or before drawing any conclusion about this injection. So coming back to our last question of the discussion, and what is your message for someone who is struggling to lose weight? He has heard about this. He want to take this injection. He has heard lots of positive, some negative as well about GLP-1 or weight loss injections. So what is a message you want to convey to these people through this discussion?
I want to tell them obesity is a chronic medical condition.
Correct.
With complex pathophysiology. If you're struggling with obesity, you are not alone, and it's not any shame to seek help. And GLP-1 medications can be powerful tools if used in a right way, along with adjunct of diet, exercise, and proper support. And our aim is not focus on a number on the scale, but overall health, well-being. That is most important. And if GLP-1 agonists are being used, they should be used responsibly under proper medical supervision, and should visit endocrinologist for proper advice and follow-up.
Yeah. Thank you very much, Dr. Sarah, for this simplified discussion of this complex topic. Viewers, please understand obesity, as Dr. Sarah mentioned, it's not just about sugar, it's beyond lots of other things. Obesity has its complications that includes heart disease, that includes brain disease, kidney disease, so many other diseases are there. So reducing obesity or reducing weight is definitely, it should be someone should be looking at it. However, if you are planning to use GLP-1 agonist or weight loss injection, our suggestion is to consult the endocrinologist or obesity specialist, metabolic disease specialist before pursuing this injection, even if they are easily available in some places. Because these medicines, definitely they will benefit you, but then they'll come with side effects which you may not be prepared for, and sometimes they can be unpleasant as well. So thank you, Dr. Sarah, for coming and sharing this discussion. If you want any other topic from Dr. Sarah in future, please mention in the comment. If you have any other questions related to today's discussion, please ask in the comment. Please like our channel, share it with the person who need to understand about weight loss injections, the pros and cons of these injections, and a detailed discussion about obesity. So thank you very much.
Thank you so much. I just want to thank you for starting with this podcast, because the proper trained physicians should be talking more about these medications, not just the social media influencers. So should reach the right person for correct advice.
Yeah, the purpose of this podcast is to get the information directly from the expert instead of some unverified websites or any other places. So that's the purpose of this podcast.
Thank you.
Thank you very much.